Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune, and today I'm going to tell you about the Hepatitis Panel, which is a group of blood tests and a few other scans that are done to check for the health of your liver and whether it is swollen or not. So, like I said, a test panel is basically a group of tests. Most of them are usually blood tests together with maybe some scans. This is what we call a test panel in medicine. It's just a group of blood tests, and similarly for hepatitis, we have a panel. Most of the times these panels try to find different groups of diseases. So for example, it might look for certain infections, it might look for certain autoimmune diseases, which is where your body attacks itself. It may also try to check the function of a certain organ in your body, which is in this case we are looking for the function of the liver. So for practical purposes, it's just a group of tests. Before we go ahead, you should know what is hepatitis. So hepatitis is basically inflammation or swelling of your liver. The liver is a large organ which is present on the right side of your stomach, and its main job is basically to create proteins and to detoxify your blood and kind of purify your blood. There are many causes of swelling of the liver, which is called hepatitis. These include viral infections, obesity or being overweight, several medicines which can actually cause swelling of the liver, autoimmune diseases where the body attacks itself, and also other causes like drinking too much. So how is hepatitis diagnosed? Well, the diagnosis of hepatitis is done by both blood tests and also by certain scans. Blood tests form the main role, they play the main role in diagnosing hepatitis. So which tests are done for hepatitis? Well, these include tests for viruses, tests to check whether you are obese or overweight, tests to check whether your liver is functioning properly. We call these liver function tests. Test to check whether there are increased levels of antibodies in your blood, which are signs of an autoimmune disease where your body attacks itself or organs inside itself. And also we do an ultrasound to check for any other problem in your liver. So these are broadly the tests which we do to check for swelling of your liver or any damage to your liver. So which tests are included in the hepatitis panel? This is a complete and rather exhaustive list of tests that I've included over here. I'm just going to go over them very quickly. So the first group of tests are the tests that we do to check the functioning of your liver. These include basically various enzyme levels like SGOT, SGPT, alkaline phosphatase, GGT, as well as bilirubins, and also the protein levels in your blood. I've created separate videos on each and every one of these tests, but what you need to understand is, and the important ones out of these are the SGOT and SGPT. These are simple blood tests which measure the levels of these enzymes, and any elevation in this value is usually a sign of some kind of damage or swelling in your liver. The next group of tests are the ones which we use to check for a viral infection in your liver. Viruses are one of the most common causes of swelling in your liver, and for this we do tests like HBsAg, HCV, and several other tests. Each of them checks for a specific type of virus. So usually in hepatitis, the viruses which are important are hepatitis B, hepatitis C. These are the most common causes. So we check for that, and all these are also blood tests. Other than this, we have tests also for parasitic infections. Sometimes a parasite like an amoeba may find its way from your intestine into your liver and start growing over there. So we have some tests which check for that. This can also be checked by means of a ultrasound scan, which is a USG scan. Other than this, we have tests to check for autoimmune hepatitis, which is a condition in which your body makes proteins that attack the liver itself. So there are a long list of tests for these. I've included them here. Other than this, we also always want to make sure that there is no cancer growing in your liver. This is another reason because of which your liver may swell up. So there are some tests for that. And then there are several miscellaneous tests which look for problems like problems with metabolic processing of things like iron and copper, which can also get deposited in your liver and cause it to swell up. So this is a broad list of all the tests that come under the blood tests for hepatitis or the hepatitis panel. So when is this hepatitis panel done? Well, if you have any symptoms or signs of hepatitis, these include things like yellow eyes, yellow urine, you lose your appetite, you have some kind of dull ache on the right side of your stomach, you might find itching all over your body, you might lose weight. All these are signs that there's something wrong with your liver. Symptoms of liver failure like swelling all over your body, or you're suddenly bleeding from somewhere, which is another sign of liver failure. And other than this, we may also like to sometimes monitor your liver health by means of this hepatitis panel if you're taking certain heavy medications. because sometimes medications themselves cause your liver to swell up. So these are the broad conditions under which a doctor will advise a hepatitis panel. So as I said, most of the tests in the hepatitis panel are all blood tests, and you just need to provide a single blood sample to get all of them done. A single blood sample will cover almost 90% of the hepatitis panel. Other than this, the ultrasound is a simple scan in which a doctor will hold a probe to your stomach and just roll it over your stomach and check whether they can see anything inside wrong with your liver. And lastly, there is also advanced scans like fibroelastography, which tell us how much of your liver has become hard or fibrotic, which is another sign of damage to the liver. So by and large, these are the three ways. None of these, except in the blood test, a needle will be inserted in your arm and a few drops of blood will be drawn. But for the ultrasound and the fibroelastography, it's totally painless. There will not be any pain. They'll just touch a little round probe to the outside of your stomach and they'll check directly. You won't feel any pain. There are no needles, nothing. How long do the results take to come back? Well, for the blood tests, most of them you'll have the results on the same day. Some of the antibody tests, especially for the autoimmune hepatitis, they can take a long time, sometimes 10 to 15 days. And most of the radiological scans like the USG as well as the fibroelastography, you'll have the report on the same day itself. I'm now going to tell you a little bit about the basic liver function tests, which are the core part of the hepatitis panel. So the first thing is that we look for transaminases. These are called SGOT and SGPT. I've also linked to specific videos on each of these. By and large, the SGOT and SGPT are the most important tests in the liver function test. Any elevation in the SGOT or PT is definitely a sign of damage to your liver, and these enzymes are very closely monitored. Usually when there is something seriously wrong, the levels rise almost up to 5 times above normal. So anything less than 2 times above normal is usually reversible, but the minute it crosses above that 2 times or 3 times above normal, it becomes more and more dangerous. The next thing that you have to look for are the bilirubins, which are basically the yellow pigment that gives your urine the yellow color. If the level of this rises a lot, it indicates something wrong with your liver. I've also made a separate video on this, which I've linked to. Other than this, we have tests like the serum protein tests. Now this is very important because the liver is the only thing that makes the proteins in your body. So you will realize that if there is something wrong with your liver, the proteins are not going to be made and the protein levels will drop. And this is seen on this test. Lastly, we also have other markers which tell us whether the tube which goes from your liver down into your intestine is choked or blocked. These are called alkaline phosphatase and GGT. Again, any elevation in their levels indicates that there is something wrong which could be causing this swelling in your liver, and it needs to be addressed. So I've also got separate videos on that. You can check them on the top right of this. The next are the tests for viral infections in the liver. Out of this, the most important is the hepatitis B surface antigen test, which checks for the hepatitis B virus infection, which is something that you can get through intercourse which is not protected, by using shared needles or from contaminated blood transfusions. You also have the HCV antibodies test, which checks for the hepatitis C viral infection. Together with this, if you want a more confirmatory test for hepatitis B, you can do the HBV viral DNA test, which actually looks directly for the hepatitis B virus itself. We also have the anti-HAV IgM test, which checks for the hepatitis A viral infection. And we also have a certain other antibodies test, which can tell us more and more about which virus you may have been infected with in the past or whether you're currently infected. Again, I've linked to videos that I've made on each of these tests so that you can look for more information. What you need to realize is that these tests will tell us whether you're currently infected with any kind of virus which could be causing your liver to swell up. The next important group of blood tests is the tests for the autoimmune diseases, which include tests like the anti-smooth muscle antibodies, the anti-nuclear antibodies, and several other tests which I've included on this page. Now, all these tests are focused towards specific proteins or antibodies. So what happens in autoimmune liver diseases is that your body begins to make proteins or antibodies that attack the liver itself. Now, there are various reasons because of which this happens. Some are just genetic, but sometimes it even just happens spontaneously, and this causes your liver to swell up because your body begins to think that your liver is something foreign. It is not, it doesn't belong to your body, and it begins to attack it like it's some foreign object or an invader. These diseases are quite serious and they need to be addressed and treated, and the blood tests which I've listed on this page are the only way to diagnose them.